Hello everyone. To start things off, this is your brain, and despite the fact that some people do not want to use it, it is a very important organ. Because the brain is so important, our body naturally encases it in the lovely little coconut we call a skull. However, this is not always enough. Over thousands of years, humans have been inventing better and better ways to protect our brain. Objective complete. 3 pounds of gray squishy mass is now safely guarded. This is wonderful, right? Well, no. There is a major flaw with the protective equipment that we use. Although the brain is protected from the outside forces in our environment, there is not much to protect us from the inside. This is where Neisseria meningitis comes into the picture. Ah yes, the diplococcal bacterium that looks so oddly familiar. Today we will look at bacterial meningitis, which affects the cerebral spinal fluid, or CSF, and causes the inflammation of the meninges. This fimbriae-covered capsulated bacterium can hide in the back of your nose or throat waiting for the proper moment to strike. Although you are not infected with meningitis yet, you are an asymptomatic carrier, capable of giving it to somebody else through either kissing, sharing drinks, or whatever activity involves the transfer of throat or nasal secretions. Not only are you as the carrier at risk, but also the people around you. The risk for others is increased depending on the setting. Areas such as dormitories, the military, hospitals, or areas of poor economic living are at risk. Because of the close living conditions, it is very easy for residents to pick up meningitis. Meningitis wants into your body and you want to keep it out. Keeping meningitis from infecting the body is a very easy task so long as everything in your body is running smoothly. There are 2 possible entryways for meningitis, directly into the blood or through the epithelial cells in the respiratory tract. So long as meningitis does not get in, you are good. Let's talk about cells. The epithelial cells in your respiratory tract are very vulnerable, as you are constantly breathing in new bacteria that can cause harm. To combat this, cilia are on the outside of these cells to push away anything from adhering to them. This is the case with meningitis. As much as the pathogen wants to adhere to the cell, it is simply pushed away by the cilia. Think of your body as a nightclub. Lights, lasers, and full of smoke. Well, maybe not, but anyway. Everything wants in, but the bouncers at the front door keep that from happening. All the pretty people are allowed into the club, but if you're ugly, you'll probably just get pushed away. So what now? Well, you're left with 2 choices. Option 1, forget about the cell and wait for a chance to get into the bloodstream, or Option 2, wait until something takes out the cilia bouncers. We'll start with Option 2 because it sounds like more fun. Take out the bouncers. When a respiratory virus comes along, the cilia are damaged and the cell is left to defend itself. With the bouncers now taken out of commission, meningitis is now free to storm the cell and party it up right into the bloodstream. Fimbriae on the outside of the cell help it to attach, and the polysaccharide capsule helps the meningitis to get through. Back to option number 1. Get into the blood. If the cilia bouncers are still there, you can wait until the bloodstream opens up. This can happen from any number of things, but I'll keep this simple. Let's say you're fighting with your little brother, and sadly, you lose. And by lose, I mean he hits you right in the face and pow! Before you know it, your nose is bleeding, and just like that, meningitis can now enter the blood. With meningitis now in the blood, it then gets into the cerebral spinal fluid. Due to the thick capsule surrounding the bacterium, it is resistant to phagocytosis and does not have to worry about running into any white blood cells. At this point, there is no turning back, and sadly, the best a person can hope for at this point is minor brain damage, deafness, blindness, gangrene, and amputation. With meningitis in the CSF, it multiplies and causes the body to produce cytokines. These cytokines act as a 911 call for white blood cells. White blood cells then race to the area, see the problem, and produce more cytokines, which call for more white blood cells that see more problems and produce more cytokines, and well, you get the idea. This is actually a key point in determining if a person has meningitis, where a spinal tap can be done on the individual. Clear fluid means that you're good, and white fluid means a buildup of bacteria and white blood cells. So by now, your meninges are inflamed and you have a high fever. This inflammation is causing the flow of CSF to slow down, and any organ under the CSF is starting to feel the pressure. This pressure on the brain is creating headaches, nausea, vomiting, increased sensitivity to light, drowsiness, and sometimes even confusion, but the meninges in the spine are also inflamed. This creates pressure on the nerves and the muscles, causing stiffness of the neck and decreased muscular control. Not all of the bacterium is in the cerebral spinal fluid, as there is still some in the bloodstream. These ugly little cells in the blood cause septicemia and produce numerous patches of broken blood vessels called petechi. This leads us to the second major test to see if an individual has meningitis, the tumbler test. By pressing a clear glass against the dots will either disappear, not meningitis, or the dots will stay there, called the doctor. As I said before, the capsules around the bacterium prevent phagocytosis, and rather than being broken down by the white blood cells, it is actually used as a little cellular car to help transport the bacterium around the body. With meningitis comes blebbing. When meningitis enters the blood, the cell will shut off bits of its membrane, and this releases lipid A into the blood automatically. By now, death is a very real possibility, but you, my dear friend, are determined to beat the system. Despite the fact that nearly all people who catch bacterial meningitis die within 12 hours of initial symptoms, you have just enough time to seek treatment. With antimicrobial drugs, a person's chance of death drops to below 15%. For women, meningitis poses a threat to those who are pregnant, as it can lead to miscarriage, early delivery, stillbirth, and even a baby born with meningitis. Drugs such as ceftriaxone, erythromycin, chloramphenicol, and ampicillin prevent the cell from multiplying and producing proteins. However, there's a very good chance you will suffer lifelong consequences of the disease, such as brain damage and/or loss of limbs. You could have gotten a vaccine in the first place to drastically reduce your risk of catching 3 of the 4 types of Neisseria meningitidis, but on a side note, here are 5 interesting facts. Bacterial meningitis is life-threatening, but viral meningitis is much less serious. Meningitis is one of 2 gram-negative cocci that can cause disease. My grandfather's sister died of meningitis when she was just 16 years old. Hippocrates described something very, very similar to meningitis in his early writings, and in 1806 was the first recorded case of meningitis in America.